hand is what we call as the laudanum. The laudanum was made by Sydenham. It's initially called the Sydenham's laudanum, was given as part of treating pain. On the left side, you can see the American Indians also had this multicolored cloth, which in the 1800s you could just put over your body and that could relieve pain. Next slide, please. And then comes James Young Simpson, chloroform anesthesia. Next slide, please. And this is a picture of William Norton actually doing this in 1846, where ether was used for tooth extraction. Next slide, please. Later on, if you look at Queen Victoria, was the first one to give anesthesia to childbirth to avoid pain, after which chloroform became famous. You're aware of the history of all this. You're all anesthesiologists. Most of you are anesthesiologists. Next slide, please. Now, interestingly, if you look on the left side, you find Coca-Cola. We all have Coca-Cola. But you won't believe this. Coca-Cola was initially started off as a brain tonic. And they had this for headache. If you had headache, drink a Coca-Cola. Now we know it may cause headache, but in those days, Coca-Cola for headache, for mental exhaustion, melancholy, drink Coca-Cola. And there were these cocaine tooth drops and this mustard. This is just about 100 years back. Mustard plasters, which acted as some kind of a counter irritant, and then opium, of course. Next slide, please. Just a few other milestones, which you're also aware probably. Humphrey Davy, nitric oxide, 1800s. Merck and Company came out with morphine preparation, 1840. And 1898, another company, part of the Bayer Company, registered diacetyl morphine under the name of heroin. And they believed that heroin was better than morphine, but it had more addictive potentials. Then in 1926, hydromorphone, dihydrocodone 1911, hydrocodone in 1921, oxymorphone, meperidine in 1939, oxycodone in 1915, and during World War II, methadone was created in 1960. Fentanyl came into being. Next slide, please. Salicylic acid was first synthesized in 1829, acetyl salicylic acid in 1852, indomethacin, ibuprofen in 1960, 1965, and meloxicam in 1970. Next slide, please. Some of the landmarks in invasive procedures. Capus in 1914 and Venning in 1918 first reported the blockade of the celiac plexus. 1911, George Herschel presented a new technique of percutaneous brachial plexus block. In 1902, there was trigeminal neuralgia, and Dogliotti was the first one to use alcohol intrathecally in 1931. In 1955, Meher administered phenol intrathecally for the first time. 1888, Robert Abbey and Bennett performed a rhizotomy. In 1905, Spiller and Martin described pain transmission in the anterior spinothalamic tract. This led to the division of the anterolateral column of the spinal cord in January 1911, which was the beginnings of cordotomy. And the first percutaneous cordotomy was treatment of pain was by Millen in 1963. And the dorsal root entry zone lesion was introduced by Nashol and was started in 1979. And 1972, Nashol and Friedman reported the first 30 patients with dorsal column stimulation for the control of pain. Next slide, please. So some of the pioneers for the effect of cocaine for treatment in the modern times was Carl Kohler, Harvey Cushing for epidural injections, Arthur Steindler, who described the basic dissociation of pain generators. And now, the very important thing which I want to tell you is, now when we talk about pain specialty, we are now talking about pain generators, and we also say that there's a huge dissociation between radiology and between what exactly is the cause of the pain. Now this is what we are trying to emphasize and teach other disciplines. Even now, other disciplines would want to say that, look, there's no radiological correlation. We've done the test, we don't find anything wrong with you. But way back in 1938, Arthur Steindler talked about the basis of dissociation of the pain generator by giving his step-by-step injections. The organization of pain therapy, the first clinic for the treatment of patients with chronic pain was established at Bellevue Hospital in New York with anesthetist E. Rose Fenster. And in 1947, this idea spread to Europe. The first pain clinic opened at the University College London, where I had the fortune of studying. In 1978, Jean Bonica proposed and founded the first multidisciplinary pain center at the University of Washington, pioneering approach to pain management based on his first ideas, which came out in the 1950s. Next slide, please. Next slide, please. Hospice and palliative care. Back in the Roman Empire, also there were these movements. By the 4th century, Christian institutions established these hospices, which later spread throughout the whole of Europe, which is mostly palliative care. And the early hospice movement came to an abrupt end with the Reformation, when many of the cloisters and the churches were closed. And the hospice tradition again initiated in the 19th century by Madame Jeanne Garnier from Lyon, France, who founded several hospitals called Calvaires. And the first Calvary Hospital, 1899 in New York, was founded as early as 1879 by the Irish Sisters of Charity. And so the story of hospice movement goes on. Next slide, please. Now, on the left end, I took this picture in particular because I'm very fond of people who follow things other than their primary profession. One man you see here, the bodybuilder, is Johnny Bull Walker, also known as John Bonica. Right? So he wrote The Management of Pain in 1953. Prithvi Raj wrote The Practical Management of Pain in 1986. And Waldman wrote his Interventional Pain Management in 1993. Next slide, please. Some of the people who have been doing spine interventions in a good way, Nikolai Bogduk, we cannot miss the names of Yachmaya Manchikante. Some of the, next slide please. Some of the modern theories. I'm going to skip the slide. Next one, please. I'm going to skip this one. Please, next slide. Next one. Next one. So coming to the question that the history is rhyming. If you look at Melzack and Casey, who describe pain as being multidimensional as complex, Dr. Ray's presentation was basically this. Sensory discriminative, affective motivational, cognitive evaluative components, Melzack and Casey, 1968. But if you look at the concept of pain as a multidimensional experience, it's been described in the ancient texts as well, dating as far as back the Syriac Empire, 200 BC, in the Book of Medicines. Next slide, please. Now, we have proven beyond doubts that hypnosis works, right? And cognitive modulation of pain is reflected in the effects of placebo and nocebo. And so now we know about all this. Now what exact, next slide please. This is exactly what was done by, next slide please, Mesmer. Although mesmerism was propounded as something to do with magnetism, just like the planets were influencing human body magnetism, what essentially was happening is nothing but hypnosis. And in fact, what you see here is Mozart. Mozart actually came to the house of Franz Mesmer to play his, there's a beautiful lyrics of Mozart which he himself wrote, praising Mesmer, because a lot of his patients were getting cured of chronic pain. Even though the mechanism was not known, people were getting cured. Next slide, please. So if you look at all the modern treatment therapies that we have on the left side, which we mostly talk about, on the right side also we have the therapies about which we do not have much of a clue. We're talking about mind-body therapies, alternative therapies, acupuncture, acupressure, chiropractic treatments. Next slide, please. And then, next slide. Next slide. We're coming to the end. So if you see the ancient traditional Chinese medicine, also known as TCM, with a lot of acupuncture needles. We also had an Indian system called the Marma treatment. If you see all these points that we're talking about here in acupuncture is there in the Marmas. And if you see on the right lower end, this is how the Marma points are being manipulated by a treatment system called as Kalari Chikitsa in India. Next slide, please. So all this is happening right now in our country. We have been talking about people being subjected to vomiting to purge out evil spirits. Probably this is not our country, but yes, it's happening here as well. But these on the top are happening in our country, where a man is undergoing self, punishment, flagellation, or getting hung by thorns. And on the right side, you have a group who doesn't believe in taking medications, but rather would like to pray and get rid of their pain. Right? Next slide, please. So, history is writing even now, and history is written by the winners. Now, why I say this is, if you look at all the history that I talked about, There's only one or two slides I talked about the Chinese. There's only one or two slides I talked about the Indian. Why? Because with industrialization came movement and learning and maintenance of records. History of pain management is incomplete, though, without the Orient and the Middle Eastern systems of medicine and philosophy. The East was relatively closed, and it was opened up for a scrutiny only after colonization. So many techniques had a double-edged character. Many of the techniques which are used to heal had a double-edged character that could even harm the colonial interests, and hence they were either smuggled or they were destroyed. Next slide, please. There is some positive evidence. Next slide, please. There is some positive evidence for, if you look at the Cochrane collaboration reviews for these conditions as far as acupuncture is concerned. Let's think about research in our traditional systems of medicine in India, which also follows the same kind of meridians and important points which I talked to you about, where we can do research and look for evidence in these aspects as well. Next slide, please. So just to conclude, that mankind has always sought to understand why they experience pain and how that pain comes about. When pain was previously thought to be a work of evil spirit, now thought of a neurological signal. However, the perception of pain is not absolute. It can be impacted by various factors. Next slide, please. Albert Schweitzer, the humanitarian physician, Nobel laureate, said, "Pain is a more terrible lord of mankind than death itself." Next slide. Thank you so much for your patient hearing.
Thank you, Pravin Thomas, for that excellent talk. It's very fascinating, but I was a bit deceived that you didn't mention about the ancient Indus culture in our Ayurveda. And Charak, Sushruta, they used to treat all these things. So when it was undivided, like Pakistan and Bangladesh and India were together, the Indus Valley. So that civilization also includes the therapy. And also I wanted that you should have mentioned the name of the societies, the name of the clinics which ancient, after the Second World War, we started the pain clinic all over the world, and George Monica and many of the Ruth and Robinson, all those names should have been there. And also I was deceived about the birth of ISSB here, the WIP coming, and the books you should have mentioned about Michael Cousin's book of the neural blockade. We read all those books when we started intervention pain management. So anyway, thank you very much.
Yeah, can I just add on a few points?
Yeah.
First thing which you said about being deceived about Ayurveda. What I talked to you about is Kalari Chikitsa, which predates Ayurveda by at least 4,000 years. Ayurveda came about 2,000 to 2,500 years back, which is basically one of the Upavedas. And the Vedas are supposed to come with the Aryans. But before that, we had a culture here, the Dravidian culture, which is almost prehistoric, which is like 4,000, 5,000 years back. So the older the system which was existing in India, which was based as the basis of Ayurveda, was pre-existent.
Yes.
The names of the